Today we're going to go over some knee mobility. If you've been having some issues with your knee, we're going to talk about some low intensity strategies to help you manage and rehab that knee. So we're going to go ahead and get started. Let's go ahead and start on the back. What we're going to do is go ahead and just start with some knee cars. We're going to hold the back of the thigh and pull it up toward our ribs. We're then going to just start with some just dorsiflexion of the ankle and then try to stiffen the calf if possible, kind of isometrically contract it as you then extend the knee and then bend the knee. And we're just going to go low intensity to start. If it feels like it's too much, I just want you to relax that ankle until you're ready to dorsiflex. Okay. Going to start off low intensity, high reps to start, just bending and extending. Now, if possible, what I'd like you to do, if you feel like your hips are out of place, you can bend that opposite knee just like that. It might actually help with stability of your pelvis and rib cage here. So go ahead and pull it up a little bit higher. Now let's go ahead and rotate externally. So turn the whole tibia out, pull it up, and then extend. Try to internally rotate, focus on the hamstring, bend the knee. Externally rotate, extend, internally rotate, bend, and hold. From here, extend the bottom knee again, extend and hold. We're going to bring that back heel off the ground. So we're going to use a little bit more core here. We're going to bend the knee, dorsiflex the ankle, and extend. Bend, extend. Bend, extend, one more, bend, extend. Good. Go ahead and just relax both legs to the ground. So same side, so we're going to use that same knee the entire time. We're going to go ahead and pull that knee to the chest. If that's too much tightness in the hip, I want you to just open up the hip and let it drop. Okay? Otherwise, just go ahead and try to find a middle ground here. Just going to open up the hip and then move that hip inward, move that hip out, hip in, hip out. And then from here, keep the hip out. We're going to extend the knee and then bend the knee from here this time. Okay, we're just going to keep the ankle at dorsiflexion, extend the knee, bend the knee, extend the knee, bend the knee. From here, we're going to turn the tibia internally, so turn the foot in, extend, turn the foot out, or externally rotate, and bend. Turn in, extend, out, and bend. Good. Okay. Let's go ahead and relax. Take an inhale and exhale here. Another inhale, another exhale. Good. We're going to go ahead and sit up for this next one. You can bring your back against the wall or get some type of support. But what we're going to do is bend one knee, and we're going to bring one hand on the inside of the foot. The elbow pit is on the outside of the knee. And then from here, we're just going to hold and stretch the tissue on the inside of our knee. If that's too much, don't go as far. Bend your knee so that you kind of feel your hamstrings start to engage as you externally rotate. And if that's too sensitive, I just want you to just hold where it's not sensitive. We're going to hold that for about the next 40 seconds here. So we're going to hold here. Breathe, inhale for 4, exhale for 8. Now, if that's too much pressure on the knee, you can let go and just hold. And you can just bring your hands like that if it really hurts. Okay? Otherwise, we're going to just inhale for 4, exhale for 8. Good. From here, we're going to try to internally rotate the tibia into the hand, but we're also going to place our opposite hand into the middle, or the middle side of the knee here. Okay. Then we're going to hold and wrap. We're going to start to internally rotate at 1%. Now, if you're already at pain level, then it might be too much for you. But if you're still good, we're going to hold here. We're just going to go 1% effort, 2%, 3%, 4, 5% effort, 6%, 7%, 8%, 9% effort. Should be barely anything, 10%, and hold here for 10, 9, 8, 7, 6, 5, 4, 3, 2. Now we're going to try to lift that foot away from the hand and hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. We're going to go back to our passive stretch for 30 seconds. Now, if you need to get out of this real quick, that's fine. Or you're just going to try to breathe. Inhale for 4, exhale for 8. Remember, don't go into any pain. Good. All right, so keep holding, keep breathing. Almost there. Good. Okay. Now what we're going to do is shake that leg out a little bit. We're going to go on our stomach. We're going to perform some knee carves, same knee the whole time. We're going to dorsiflex the ankle and try to bring that knee to the glute. We're going to bring our hands on our forehead and our hands and hold. So we're going to externally rotate the tibia and bend, and then extend all the way. Try to internally rotate, bend, externally rotate, extend. In, bend, out, extend. Just going to bend, turn in, extend. Bend, out, extend. Good. From here, we're just going to point the toe. This time we're just going to bend the knee with our toe pointed and hold for 5, 4, 3, 2, and 1, and relax. Go ahead and dorsiflex. Plantar flex again. We're going to try to bring that knee closer to the glute and hold. 5, 4, 3, 2, and extend. Keep the toe pointed. Bend. Extend. Bend. Extend. We're going to bend and hold. 5, 4, 3, 2, and relax. This time we're going to dorsiflex and hold for 5, 4, 3, 2, and extend. Bend, hold, 5, 4, 3, 2, extend. Bend, hold, 5, 4, 3, 2, and relax. Take a quick break here. Can squeeze the quads so the knees leave the ground and hold, and try to shoot those heels back. Good. From here, what we're going to do is just kind of open up the hip, just to kind of turn our attention away from the knee and hold this position. You can go back to the stomach, or you can go onto the forearms here. And because the knee and everything is connected, we're going to work a little of the hip. We're going to internally rotate and hold. 5, 4, 3, 2, and relax. Same thing. I want you to focus on really squeezing that glute med and holding. 5, 4, 3, 2, and relax. Same thing. Hold. 5, 4, 3, 2, and relax. Okay, this time we're going to try to hover that leg off the ground and hold for 5 seconds. Here we go. Push into the ground like a goalpost, or tee it out, or you can just go back to where you were. whatever feels best. We're going to take an inhale, irradiate, lift off, hold, 5 seconds. Here we go. Inhale, irradiate, and up, hold, 5, 4, 3, 2, and slowly bring it down. One more. You can turn the head to the side if you want, and I'm going to go half goalpost, half T. Here we go. Inhale, irradiate, and up, hold, 5, 4, 3, 2, and down. I'm going to bring that hip back. I'm going to go back to those knee cards. Okay, do them any way you want. Just make sure that you're externally or internally rotating at the top and bottom. Keep going. Good. Okay, we're going to go back to our seated position. Okay, we're going to bring that knee out in front. We're going to shake it out a little. We're going to bend the knee here. If you want, you can stand up and place your heel on top of a bench and just use some dowels for this part, or you can just bring one leg in and one leg out, okay? If that doesn't work, you can stand or just bring one leg out like this. All I want you to do is focus on bending that knee and focusing on that hamstring here, okay? So what we're going to do is bend this knee, hold, and what I want you to do is kind of grip the ground with your hamstring, and then I want you to try to bring those sit bones back and hinge forward. Okay, we're going to hold here. Breathe and hold. If that's too much, you can bring your hands behind you and work your way to hinging forward. Okay? Breathe and hold. Inhale for 4. Exhale for 8. And if you need to if you want to kind of move that around, if you feel stiff here, you can go ahead and actually rotate. You can also do the same thing, just like this, or standing with your foot on a bench or chair, holding onto some dowels. Okay, let's go find a position that works best for you. Keep that knee slightly bent. I want you to grip the ground with the heel and try to swing those hips back and hinge forward. Again, if you want to just bring your hands behind you and hinge forward, that might work as well. Inhale for 4, exhale for 8. Now what we're going to do when we get to our 13-minute here is press the heel into the ground, 5% effort. Okay, so we're going to skip to 5% effort and hold. 10% effort, pushing into the ground. 15% effort, squeezing the hamstring, trying to bend the knee. 20% effort, toes are up. Go ahead and grip the ground here behind you, whatever you need to. Make sure that your whole body is starting to squeeze from your chest to your abs. Everything's engaged. Go to 25%, pushing that heel into the ground, trying to bend that knee. All the way to 30%, 40, 45 to 50, and hold for 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2. Now we're going to try to lift the foot off the ground. You can lean back if you want to cheat, or stay where you are and hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, and slowly bring it down. And we're going to try to breathe into this. Hold here. If you're cramping up, you can bend the knee. You can go into a 90-90, but if you're able to breathe into it, I want you to just focus on your breathing. I know you're going to feel it in your hip flexor here. If you need to get out of it, get out of it. Keep breathing here. Good. From here, let's go ahead and bring those feet together. That'll help open up that hip and press those knees down. We're going to use a little bit of 90-90 work here. Focus more on that same side. So keep that same side in mind. We're going to go to hip internal rotation. We're going to twist toward that back hip. Hold and breathe. Inhale for 4, exhale for 8. Inhale for 4, try to exhale for 8. Good. From here, we're just going to breathe and try to bring one hand on that knee if possible. We're going to try to get out of this position by trying to externally rotate into the hand, causing a little of that isometric contraction. We're going to go from 5% all the way up to 30 and hold for 10 seconds. All right, start at 5%. Try to get as close as you can. You can use 2 if you can, or just 1 and hold. 5%, 10, 15, 20, 25, 30, and hold. 10, 9, 8, 7, 6, 5, 4, 3, 2. Rails. Try to pull that foot off the ground and hold. Even if it doesn't leave the ground, squeeze and hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, and relax. Good. All right, now what we're going to do is just breathe into that position, maybe go a little bit deeper if you're able to. If you need to get out of this position, go ahead. Keep breathing. Now we're going to face forward. Make sure we're at 90 degrees with our hips, 90 degrees with our knees. We're going to try to make sure our head is over our sit bones, maybe hinge forward so our sit bones go back. And then we're going to internally rotate that back hip so the foot leaves the ground and hold for 5 seconds. Here we go. Inhale. Lower back and ribs when on our inhale. And up and hold. 5, 4, 3, 2, and bring it down. Same thing. Inhale, radiate. Up, hold. 5, 4, 3, 2, and down. One more. Inhale, radiate, and up, hold. 5, 4, 3, 2, and slowly bring it down. Good. Go ahead and go back to that hip internal rotation. Breathe. Okay. Now what we're going to do is go out to a straddle position. So we're just going to go into our straddle axials here. But I want you to really focus on the internal rotators and external rotators while we do that. Good. All right, now go ahead and we're going to move that same sided ankle. Just 3 rotations each way with the ankle, all the way around. And we're going to do 3 cars each way, in, out, in, and down, out, up, in, and down, out, up, in, and down. Now reverse it, in and up, out and down, in, up, out and down, in, up, out, and down. Good. Okay. Last pals and rows is going to be our knee flexion, and we don't want our back arched. So go ahead and get a cloth, a shirt, or a towel. Okay, I'm just going to show you a simple way, even if you just had a sock. Okay, so that's going to help. Okay, just a sock, because I don't want my back arched. I want my ribs and pelvis stacked here. I'm just going to hold and breathe. I can use a block for my head, or I can just rest like this. I'm going to breathe, inhale for 4, exhale for 8. Try not to extend the back. Go to your end range here. Inhale for 4, exhale for 8. Try not to go to any pain. You can dorsiflex or plantar flex. I'm going to start with plantar flexion, and then I'm going to go with dorsiflexion next. I'm going to hold and breathe. I'm going to start to try to kick my leg out of this position, 1% effort, 2% effort, 3, 4, 5% effort, and hold. 5 to 6%, 6 to 7%, trying to kick the leg out, 7 to 8 to 9%, to 10, hold, 10 seconds, 9, 8, 7, 6, 5, 4, 3, 2. Now try to bend the knee more so that you get a little slack in the sock or your towel and hold. Try to get the heel to the glute. Squeeze. 10, 9, 8, 7, 6, 5, 4, 3, 2, and relax. Go ahead and dorsiflex or plantar flex. Switch. Do the same thing if you want. Gonna hold here. Inhale 4, exhale 8. Good. We're going to try to kick it out. Go 1 to 2 to 3 to 4 to 5%. 5 to 10. 10 to 15. 15 to 20 and hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, and rails. Try to bend that knee further toward your glute so you get a little slack in your cloth and hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, and relax. Just breathe. Good. Now let's go on to our back to end it the way we started it. All right, so now we're going to go ahead and pull that knee up, or you just can keep that knee out, whatever car works best for you. Now hold on to the back of the hamstring, dorsiflex the ankle, extend and bend here. Good. From here, we're going to externally rotate and extend, internally rotate and bend. Out, up, in, and down. Out, and up. Hold it. Down. Internally rotate in. Extend. Out. Down. In. Extend. Out. Down. Good. Okay. Now, for our last kinetic stretch, we're going to bring our hand on the outside of the foot with the opposite hand, and the same sided hand will go underneath and hold on to the forearm. So now we started with the medial part of the knee. Now we're going to go to the lateral part. So now what we're going to do is finally get to, which could be the most sensitive for you. From here, what we're going to do is breathe and hold. Inhale 4, exhale 8. If you're not able to get into this position, you can extend the knee a little and do the same thing until you're able to bend it. So obviously the more advanced, the more you're able to bend. Breathe and hold. Inhale 4, exhale 8. And for this one, we're just going to try to externally rotate the shin into the arm. So what I could do is I could also kind of create more tension by going like that, and so you have more tactile cueing if you want to switch it up. But if you're set here, that's fine. We're just going to externally rotate the tibia and the foot at the same time into that hand that's reaching across. Okay. You feel like you're getting tightness here, that is expected, but you're also going to feel it all the way up and down here. So get into that internal rotation. We're just going to kinetically stretch. We try to push into the hand and try to hold at that external rotation for 5, 4, 3, 2, and then back to internal rotation. External rotation, in, and relax. Go ahead, give yourself some ankle cars. If you're feeling it too much in the ankle, it could be an issue, but that's fine. We're doing the best that we can. From here, we're going to place those hands on outside of the knee. I'm just going to focus on internally rotating and externally rotating. Now focusing on your external rotation, the lateral side of the hamstring, internal rotation, the medial side, okay? Now you might still be feeling it here, but we're going to do the best that we can. Here we go. External, internal. External and internal. External and internal. Good. All right. So we're going to finish it off with some patella cars. If you're not able to get in a relaxed position, you might have to stand up for this one. If you are standing, it'll look like this. Make sure it's relaxed. You can have your butt against the wall. You're trying to push that patella around. Otherwise, we're going to see if we can maybe bring one leg in, one leg can be out. Maybe your back's against the wall. And you're just pushing that kneecap around in a circle. Each way about 4 times. Good, okay. Now we'll go to our kneeling hips matrix. Kind of loosen up just a little bit before we stand up. What we're going to do is squeeze the glutes, the bottom glutes here. Try to extend those hips without extending the back. Going to hold here. Squeeze the bottom glutes and hold. Remember, protract, round out the clavicle in your Wonder Woman here. Breathe. Trying to get the ears behind the shoulders. Squeeze the bottom glutes and hold. We're going to move the medius, the glute med, so that we rotate our body. We're not going to use our waist to do this. We're going to use our glutes. And we're going to hold one side. So make sure both bottom glutes are squeezed. So my left side is squeezed here, turning toward my right. Both bottom glutes are squeezed. I'm going to hold 5, 4, 3, 2, and back to neutral. Both bottom glutes are squeezed. Start. Hips forward. Squeeze that right. Hold, twist without using the back. 5, 4, 3, 2, back to neutral. Try to get your ears behind your shoulders. Really protract. If you want, bring your arms out. Big blowout. Hold. Squeeze the glutes. Both. Turn. Hold. 5, 4, 3, 2, back to neutral. Squeeze the glutes. Squeeze and turn. Hold. 5, 4, 3, 2, and relax. If you can, sit down on those knees. If not, you can curl those toes underneath the body. Good. All right. Now what you can do is go into a downward dog position and kind of pedal out those ankles one at a time. If that doesn't work, and what we're going to do next anyway is a wall calf stretch. So push your hands into a wall, and we're going to focus on that same leg. So front leg is forward, other leg is back, focusing on that same side we've been focusing on, and just focus on keeping the knees straight. Both hips are forward, feet are forward, and hold and breathe. Inhale 4, exhale 8. Good. Start to press those toes into the ground. 5% effort, 10% and hold. Now pull those toes toward the shin. Hold 5 seconds. 4, 3, 2, and relax. Step that foot forward. Now this time our back knee is bent and our front knee is forward. Same knee we've been working on. This you might have to be a little bit more sensitive with. So do the best that you can and hold. Passive stretch to hold. Inhale 4, exhale 8. This is targeting more the soleus. And then start pressing those toes into the ground. 5% effort, 10% hold. 5, 4, 3, 2. Pull the shin, toes toward the shin and hold. 5, 4, 3, 2, and relax. Now if you can, bring your foot up a wall or on some type of a slant board. It could be something like a kettlebell, something like that, or a dumbbell. But what we're trying to do is trying to get that foot up a wall to really get the Achilles. We're going to breathe and hold. And we're not going to do the pals and rails. We're just going to give it a quick stretch. And that's going to be it, okay? Go through a couple ankle curves. Okay, a little knee. Okay, and then maybe a hip using a wall. Seeing how that feels. And you just did a lot. Now you just did 30 minutes on one side. You can get the other side right now, or what I would recommend is go for a walk, get the other side, and then go for another walk, okay? So whatever you do is up to you, but definitely go for a walk regardless if you get your opposite side or not. So hopefully that worked well for you. Hopefully your knee is going to do better, and your hip, and just that whole side that you're working on. And again, if you want to go ahead and do this on the other side, go ahead and do that now and go for a walk, or go for a walk and try to use what you just kind of expanded. All right. Thanks a lot and have a good day.